Okay, moving into the respiratory system, I'm going to take you through the really pretty easy anatomy and functions of those structures in this tape, and then save the heavy-duty physiology for later. Just wanted to functions of the respiratory system, for gas exchange, but also there's some other things involved. It counts as an excretory system because you're getting rid of excess CO2 from the body, from the blood. Also for thermoregulation, you get rid of some heat. Also, you get rid of some water from the body in exhaled air. The tissues, boy, you're going to see a little bit of everything almost. You're going to see quite a couple of different kinds of cartilages. You're going to see quite a few epithelial tissues. The main epithelial tissues you're going to see in this system are going to be pseudostratified, pseudostratified ciliated columnar, which you see at the bottom left. We'll talk about it more in detail. You're going to see simple squamous epithelium down in the lungs. Up at the top right, you see it. You're going to see some stratified squamous epithelium. Remember the skin. You'll see that in the upper respiratory tract. And you'll see a little bit of simple columnar in a few of the small bronchi. And then we move into simple cuboidal for the small bronchioles. All right. There are a couple of things down at the bottom to point out. Cilia, you see it right there? Well, if you look at the pseudostratified over there, right along here is where you're going to find those cilia. Remember also in the lymphatic system we talked about macrophages. Well, there we go. You're going to see a lot of those down in the lung. We'll see them more coming up. Okay. Nasal cavity, nose. First, let me point out external nose, it's all cartilage. That's all there is to say. The functions of the nasal cavity. Here's the nasal cavity right here. Let me outline it right there. This is the hard palate right there. And it's made of palatine and maxillary bones. This is the soft palate. It has no bone in it. And that's the dividing line between nasal cavity and the oral cavity, your mouth right there. The functions of this nasal cavity. Wanted to point out these shelves that are sticking out into the nasal cavity. You'll see in more detail coming up. They slow air going down into your lung, makes it easier for the moisture to go from mucus and from your blood vessels, which are very close to the surface of your epithelium in your nasal cavity, to move into the air. So by the time the air gets down to the lungs, it's been moisturized. So it's very high humidity air, keeps the lungs from drying out. Warming, same thing. You get a transfer of heat from blood into the air. Filtration, got lots of little hairs, cilia that we'll talk about along the way. Olfaction, you already know, smell. That olfactory membrane is up here. Resonation. Remember your larynx, which is off the screen. It's down here somewhere. Makes sound waves. Those sound waves kind of bounce around on the inside of your nasal cavity. When you have a cold, sinusitis, this cavity can clog with mucus. And you already know, I'm sure, that when somebody who has a cold or sinusitis is talking to you, their voice sounds different than if they have a clear nasal cavity. That's resonation. Okay, the sinuses, good view. They're named for the bones, and you can see them pretty much on all these views. This is a cut section on the right. An actual piece, like a piece of bread has been cut out of a loaf, except it's been taken out of the skull. So here's a maxillary sinus. There's a maxillary sinus. There's a maxillary sinus. You can see some little ethmoid sinuses right in here, and maybe a few little ones here, and then right in here are ethmoid sinuses. So remind yourself about that. I mentioned those ledges that project outward from the middle area of the nasal cavity. You can see them really well here. Let me get rid of those marks. So remind yourself about bones from 2401. This whole top area right here is the ethmoid bone. Ethmoid. And remember that there's some little projections called concha. You didn't have to know those concha for 2401. They weren't on your list. But these are the superior concha. And then there's the medial concha, or middle concha. And then there's the inferior concha right there. The superior and middle are part of the ethmoid bone. You didn't have to know those, but you had to remember the inferior concha. These guys down there. And there's a really good view of one right there, and there's another good view of an inferior concha right there. These sinuses can make mucus, or do make mucus, and they drain into your nasal cavity. They also lighten the load of the skull. Okay, 3 parts of the pharynx, the throat. So when you have a sore throat, like a strep throat, it's called a pharyngitis. You see it right there. Trying to get rid of the, there we go. Okay, so the 3 parts. I pointed out the dividing line right there between the nasal cavity and the oral cavity. By the way, this guy's tongue is removed. There is where his tongue would be, and there is his tongue right there. Okay, so the oral cavity is right there. Here's the oral cavity right here. Let's go straight back. Well, there's a little thing. Here's a good view of soft palate right there, by the way. And this little guy is called the uvula. And you see it, well, there's a good view of it right there. It plays kind of a part in swallowing, and we'll cover it then. But if you go straight back, if you're looking right there, you're looking in that black gaping area. That's the oropharynx that you can see in a mirror. You can't see the nasopharynx. It's above this area. It's above the palate. It is located right there. Again, the oropharynx is going to be this area right there. Now, going down to the laryngopharynx, let me highlight the shape of the larynx. There's the larynx right there that I kind of put a line around. And let me get rid of some of the stuff so you can see. Okay, now this little guy sticking up is called the epiglottis. You'll see it in much more detail coming up. Its job is to get pushed down, and when it gets pushed down, I can't quite get it to do what I want, but when it gets pushed down, it covers over the entry to the respiratory tract. That goes down to the larynx and the trachea and the lungs. That happens when you swallow food and drink. You only want air. Air can go, well, sometimes you swallow air. That's burping that gets it out. But obviously, from your mouth, you're going to add food and drink. And you don't want that going down your respiratory system. You want it going down your digestive system. So again, starting right at the laryngopharynx, you've got the dividing line of 2 tracts right there. Okay, we're going to be moving into the stratified squamous areas of the larynx in just a second. Here's a really good couple of shots. Here's some goblet cells. You can see nice ones right there. They secrete mucus, which is this yellow stuff right out there. Good view of a goblet cell there, good view of goblet cells right there, good view of goblet cells right there. Cilia, easy to see. You can also have glands down in this area too, extra glands that are making more mucus. These are columnar cells, as you can see right here. It's called pseudostratified because sometimes it almost looks like it's got more than one layer. See kind of how messy it is here? It's not as pretty as simple columnar. Okay. Going down to the larynx. All right. So look at the vocal cords. Whoops, I didn't mean to do that. All right. Look at the vocal cords. You're looking down into the larynx. This is the epiglottis right there. So this is the ventral side, and this is the dorsal side. But I wanted you to note the vocal cords. They're right there. And those vocal cords, just to point kind of where they would be on the inside, are about right there. So anything up here is going to be stratified squamous. Oh, sorry. Yeah, right. Including the vocal cords, actually. And anything below the vocal cords, we're now going to be into pseudostratified ciliated. Okay. Cartilages. There are 9 total cartilages in the respiratory system. Those cartilages are associated with muscles, skeletal muscles, by the way, and those muscles and cartilage pull on the vocal cords, which moves the vocal cords open and closed. You don't need to know the paired cartilages. There are 3 pairs, total of 6. But you do need to know these single ones. So let me point them out. You see the thyroid cartilage right there. It's the big one. It's the Adam's apple. This is hyaline cartilage. You're going to see lots of hyaline cartilage. Then right down here is the cricoid cartilage, also hyaline cartilage. In fact, all the rest down the trachea is hyaline cartilage. However, up here at the epiglottis, elastic cartilage. Remember, E-elastic, E-epiglottis. The opening that you see right here, made by the vocal cords, called the glottis. All right, so that takes us down to phonation now. All right. First, notice the open and closed vocal cords on this picture. So on the left, the vocal cords are fully open. The glottis is as big as it's going to get. Notice that this is the orientation when you're just breathing. But when you want to say something, sing, anything like that, notice that the vocal cords close, creating only the tiniest little sliver of an opening. And so when air comes through the vocal cords, it causes those cords to vibrate, and that's what's making sound. So let's go pitch. Pitch is frequency. High pitch, low pitch. Cycles per second. Think about what determines pitch of sound, in this case, is there are a couple things, but the main ones are the length of the vocal cords and the tension on the cords, how tightly they're pulled. So the more tightly they're pulled, the higher the pitch. Think about a guitar. You've got those chords, those little lines that are, that you strum. And if they are pulled tightly, I think they're called keys on a guitar, and you twist them and it makes those chords, pulls them tighter, you get a higher pitch. The other thing I mentioned was the length of the cords. Think about a guitar versus a violin. Shorter chords on a violin, higher pitch. Now think about men and women. Men have a larger larynx with larger vocal cord length. Loudness. When you make a sound, you are exhaling air. The air is coming from your lungs coming up, not the other way around. So when you take a big amount of air in and then blow it out, you're going to get a loud voice. If you only take in a small amount of air, blowing it out, you get a whisper. Loudness is given as decibels. Before we leave it, there are 2 pictures here, endoscopic pictures. They've actually put an endoscope and with a camera attachment down the person's throat. The top one, good view of vocal cords and that glottis. Look at the bottom one. That's obviously not normal. That's laryngeal cancer, very often associated with smoking, chewing, tobacco, things like that. Okay, moving down. Now we're going to be in the lower respiratory tract once we leave the larynx. We're now in the trachea. Let me point out orientation here. Look at that esophagus right there. It's behind it. This is dorsal. This is ventral. Notice there's a big blue thing right in here. This is hyaline cartilage. It's a cartilage, a C-shaped cartilage ring. You can see them over here. Here, 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 here. There are about 18 of them, I believe, along the trachea. By the way, this tissue, kind of a yellowish in between, that's connective tissue. Notice that these are C-shaped. They end right there. Well, why would that be? Now, look at the esophagus. It's normally collapsed unless you have something in it. If you ingest a large chunk of food, this esophagus has got to expand in size. Notice that at the back side of the C-shaped cartilage ring right here, there is no cartilage. It's just a little band of muscle. If this esophagus has to expand in size, let me get rid of that, all that. If it has to expand in size, look what can happen. It can enlarge and kind of pooch into the cartilage ring a little bit. And that way, food particles don't get hung up and potentially choke you. What else on this? Obviously, tracheotomy is cutting through this area, usually using a horizontal cut. Actually, you can do it either way. No, I was right to begin with, a vertical cut. Then you can put something in there and keep it open. Whereas if you make it horizontal, the rings tend to come back down together, harder to breathe. Also an endotrach tube, of course, is put into this area. Okay. I don't think there's anything else. Oh, you see some glands in here for making some extra mucus. Remember, this whole lining is pseudostratified. Ciliated columnar. Okay, we're moving down into the lower areas towards the lungs. So here is the trachea. Unfortunately, the aorta is in the way there, but kind of think about that being gone. Okay, so we're going to come down here, and right there behind the aorta, it's going to split. All right? Primary bronchi. The primary bronchi are going to split into, on the right side, 1, 2, 3 secondary bronchi, and on the left side, 1, 2 secondary bronchi. Each secondary bronchus goes to a lobe. So, lobe of the lung, lobe of the lung, lobe of the lung, and over here, lobe and lobe. Each lobe gets a secondary bronchus. We'll move down along through the smaller ones coming up in a minute. You remember I mentioned simple columnar down in the bronchi, the smaller bronchi. The upper bronchi, primary and secondary, pretty much look like the trachea, pseudostratified, but when you get down into the really low bronchi, there's some tertiary ones that you don't need to know. It becomes simple columnar and continues on, and we move down into the bronchioles, and at the ends, the very small bronchioles, we now move into simple cuboidal till we get to the lungs. And then, of course, you see some simple squamous right up here. And here's a nice histology slide. Low power. Okay, so here's the important stuff. All right, let me take you down. Here's the trachea. Primary bronchus, primary bronchus. Well, I guess we'll go ahead and go into the secondary. Secondary, secondary. So in other words, there would be a lobe around each secondary. Notice what's happening to the hyaline cartilage pieces. Remember, we started out with circular C-shaped rings up here. Notice that the cartilage is becoming progressively smaller, smaller, smaller until you get down here, the bronchioles There's not any at all. Okay, so moving on. Notice that secondary bronchi split into tertiary bronchi. You see them there. More here. Okay, so we're going to keep going down. We're going to go down into the bronchioles now, and we get lower, and we now end up at a terminal bronchiole. Now think about a cluster of grapes. You've got, you buy a big bag of grapes, you pick it up, there's usually a big stalk, okay, holding a bunch of little branches with grapes on them. That would be kind of like a terminal bronchiole. So here is a terminal bronchiole right there. Okay, there's your cluster of grapes, the alveoli below it. And coming from this terminal bronchiole, there's some smaller little bronchioles going to, and this one has its own little cluster of grapes over here, leading down to the alveoli. These are called respiratory bronchioles. And if you keep following that down, here's a good one right here. We get to kind of a dead end right there. It's called an alveolar duct. And this is where the actual alveoli come off of, the alveolar duct. And this is where we're going to change over to simple squamous. You look over the x-ray right over here. You'll notice that lung tissue is not dense at all. It's air-filled, and therefore you don't see anything over here. You shouldn't see anything. However, you can see the bronchi right in here. You can see some small tertiary bronchi and maybe even some big bronchioles in there. The view you're looking at over here, right there is a bronchus, and right there is a pulmonary artery. Okay, going down into the lungs. Let's go ahead and move a little bit lower. We're about done with the anatomy. So let me point out we are in the thoracic cavity. There is the thoracic cavity. Good view of the diaphragm right there. Diaphragm's been removed on this one. It's not just a flat thing that goes across like that. It's actually domed. We'll talk about it more coming up. All right, so anyway, notice, remember I mentioned that the secondary bronchi each go to a lobe, so you know right away that there's more than one big bag on each side. So on this diagram down towards the bottom, you see a fissure here, and a fissure here, and a fissure here. That means here's a lobe, here's a lobe, here's a lobe, superior, middle, and inferior. And then on the left, there's a superior lobe. Bottom, there's an inferior lobe. It's not important to know the names of them. You'll notice there are 5 lobes in humans. Let's see if I can get a good view of the cavity. Let me change my little to a small red line. Okay. By the way, reminder, these are ribs right there. All right, so notice this dark gray layer right there around the lungs. That is the visceral pleura. Remember your serous membranes? Pleural, serous membranes, pericardial, peritoneal. You'll see that in the digestive system. So, pleura, visceral and parietal. Okay, so you can see that the visceral pleura forms a lining around the lungs. Now, on the outside of that, this is where it's going to get kind of tricky. Maybe on this top one you can see it better. There's a kind of a dark red right there. There's the cavity. Let me see if I can point it out on this. There's a cavity right here on the outside of the visceral pleura that's full of fluid, pleural fluid. Then on the very outside, on the other side of the pleural fluid, right on the inside of the inner rib cage, this is where it's going to get tough because it's such a... I'm trying to mark on the inside of the rib cage where the muscles are. That's going to be your parietal pleura. So remember, parietal, pleura. And in between the two is pleural fluid. If you have a problem in this area, it causes for painful breathing because, of course, the lungs inflate, deflate, and you don't want them to be hitting the riding across the inside of your thoracic cavity, creating friction. It's called pleurisy. Note right here, there's kind of a, on the left side of the lung, there's kind of like a little notch cut out for the heart to sit better. It's called the cardiac notch. Blood supply, pulmonary, arteries and veins, bronchial arteries and veins, nerves. For breathing, we're going to talk about these in more detail in a minute. Phrenic nerve to the diaphragm. Remember, this is the diaphragm right here, because that does most of the work of your inhalation, exhalation. And secondary to that, you've got some intercostal nerves that they come off of the spinal thoracic nerves. And those intercostal nerves go to the intercostal muscles between your ribs. Then, along the way through this chapter, we're going to be talking about sympathetic and parasympathetic control. Let's start with sympathetic control. Coming off of the spinal cord, there are some thoracic nerves on either side of the spinal cord, and those carry sympathetic autonomic nervous system stimulation, and so S is for sympathetic. For parasympathetic, P is for parasympathetic. Remember cranial nerve 10? Vagus. It's cranial nerve number 10, and then it comes down directly to the very small bronchial muscles. I forgot to mention that there is quite a bit of smooth muscle around the small bronchioles. The bronchioles control airflow in that they can dilate, get bigger, or when their muscle contracts, they get smaller and it reduces the airway. So, and there is no muscle around the alveoli. It's all bronchiolar. Okay, so moving down to the alveoli. All right, so the view you're looking at over here, there's a bronchus right there, surrounded by alveoli. And I'm going to go to a bit bigger pen size. All right, so here is one alveolus right there. Okay. Let me point out a couple of cells. Well, first of all, let me point out the blood vessels. Capillary here, capillary there. Remember, there's a little capillary bed around every little alveolus. That's, of course, where gas exchange is going to be happening. All right. This big green guy right over here, it's making a phosphoprotein chemical called surfactant. We'll talk more about it coming up. And as we talk about surface tension also. And then there's a little guy in blue. I circled him in a blue symbol. He is a macrophage. He's called a dust cell. His job is to wander around and look for things to eat. Now, let me point out where the surfactant is. Again, we're going to talk more about surfactant and what it's for coming up in the future. But this green line, in fact, there's a label right there. Surfactant reduces surface tension within the alveoli, which in the end keeps the alveoli from collapsing. That's its job. Now up here at the top, let's see, let me get rid of all those colors. And if I go down here and I enlarge this area right there, I've made a big box around it, and you look at it up here, that's what you're looking at. This is the capillary. Here's the simple squamous wall, simple squamous epithelium, or what's called the endothelium of the capillary wall. Then here is the alveolus, right down here. And this is simple squamous epithelium of the alveolus. So you've got simple squamous for both walls. And then in between, a little gray area right there, this is the basement membrane, which kind of holds the integrity of the two epithelial membranes together. This, of course, is where gas exchange is occurring. This is called the respiratory membrane. That is what the respiratory membrane is. It's this area. Okay, I'm going to stop right there.